Blood pressure is usually represented by two numbers. The top number is systolic blood pressure, the arterial pressure when the heart contracts. The bottom number is diastolic blood pressure, the arterial pressure when the heart relaxes or refills. Most often, blood pressure is measured in the brachial artery in your upper arm. Because the pressure is higher there, it's likely to be high in all arteries. Evidence shows that even moderately high blood pressures can significantly increase the risk of heart disease. Normal systolic blood pressure is defined as less than 120 millimeters of mercury, and normal diastolic blood pressure is less than 80 millimeters of mercury. Systolic blood pressure is considered elevated if it's between 120 and 129 millimeters of mercury, while diastolic pressure remains under 80 millimeters of mercury. Stage 1 hypertension is defined as a reading between 130 and 139 millimeters of mercury systolic, and between 80 and 89 millimeters of mercury diastolic. Stage 2 hypertension is any reading of 140 millimeters of mercury or higher systolic, or 90 millimeters of mercury or higher diastolic. Normally, both systolic and diastolic pressures rise and fall together. But not always. Sometimes only one number is too high. This is referred to as isolated systolic hypertension or isolated diastolic hypertension. High blood pressure is a serious problem for blood vessels because it causes wear and tear on the endothelial cells that line the inside, leading to complications such as myocardial infarction, aneurysms, or strokes. About 90% of the time, high blood pressure occurs without an identifiable cause. We call this primary or essential hypertension. In other words, the pressure in the arteries rises silently over time. There are several risk factors: older age, obesity, a high salt diet, and a sedentary lifestyle. With the exception of age, all of these can be improved through lifestyle changes, which can help reduce blood pressure. Now, about 10% of cases have an identifiable cause. This is secondary hypertension. Anything that restricts blood flow to the kidneys can raise blood pressure. For example, atherosclerosis, vasculitis, or aortic dissection. The kidneys play a key role in regulating blood pressure. When blood flow is reduced, they release the hormone renin. Renin helps the kidneys retain more water, increasing blood volume and raising pressure. Other conditions can also cause secondary hypertension. For example, fibromuscular dysplasia, which affects young women, can thicken the walls of arteries and reduce kidney blood flow, triggering more renin release. Another example is a tumour producing excess aldosterone, which, like renin, leads to fluid retention and higher blood pressure. Now, if blood pressure rises too rapidly, it's referred to as a hypertensive crisis. This means a systolic pressure greater than 180 millimeters of mercury, or a diastolic greater than 120 millimeters of mercury. A hypertensive crisis can be classified as urgent, where no organ damage is present, or emergency, where damage to the brain, kidneys, heart, or lungs is already evident. Primary hypertension is usually asymptomatic, which is why it's often called the silent killer. Secondary hypertension may cause symptoms related to its underlying condition, and in a hypertensive emergency, patients may experience confusion, drowsiness, chest pain, or shortness of breath. The first line of treatment for high blood pressure is lifestyle modification, dietary changes, exercise, and stress reduction techniques. When necessary, blood pressure lowering medications may also be prescribed.